There are some pockets of the U.S. health system that are excellent. Cancer care in the U.S. is better than anywhere in the world. We lead the world in innovation and development for pharmaceuticals. But there are major areas of dysfunction within the U.S. healthcare system. Paragon is the premier research institute in the country focused on evaluating how government programs are actually working, not just the intentions behind government programs, and then evaluating free market solutions that empower patients, that reform these programs, that realign incentives so that we're not just focused on increasing spending, but getting increased value out of the system.
Paragon has gathered a team of true experts who have been there, who have done it, who know how the government works, how it should work, and we are here to be a resource to anyone that wants to see our system improve.
The most obvious major problem in public health in recent years is obviously the COVID pandemic. And we learned during that pandemic that a lot of measures that seemed like they made sense in the short run had very bad side effects in the long run.
I think we learned that government's response failed in a lot of ways. I mean, it was overwhelmingly centered on reducing the spread of the virus, which may have made sense at the beginning before we had data and I sort of understood the risk profile of the virus. So a few examples. Closing schools and keeping them closed for so long was a disaster, and there was a significant loss of learning associated with that. We also know that the policy of prohibiting people from seeing their loved ones who were dying was just inhuman.
Improving public health really requires trusting in people and understanding that they know their situation best. And that allows us to harness the individual knowledge of each person, and it also allows us to meet them where they're at. So respecting that and really trying hard to essentially listen and devising the approaches around that is really important.
Public health officials, especially on the state level, and state officials should be working with the private sector and individuals to develop initiatives that are derived from the ground up and that will help the citizens where they should be served.
I would tell public health professionals that what Paragon is about is trying to figure out what are the conditions that will encourage innovation, that will bring new life-saving drugs and therapies to market, that will empower patients to take charge of their own health and improve that health without necessarily having to have the government involved in doing that.
I want to help people in any way I can. And reforming healthcare policy so that it really serves each and every American the way it should, that's what's important to me. I want to help my uncle who has a rare disability. I want to help my grandmother with dementia. I want to help my mom with diabetes. And I want to help the millions of others who I'll never even meet, but who all need our healthcare system to work the way they need it to work for them individually.
I think in order to achieve real substantial healthcare reform, you can't just focus on Washington. You have to focus on educating yourself. You have to focus on educating key people that are both delivering that care, the patients and the public who need that care, and having a real honest conversation about how do we empower people to make decisions and to get the care that they need. I think we are uniquely positioned to offer a fresh perspective, to offer bold and innovative reforms that are based not just in Washington, but in communities and based in a belief in people.
What excites me about the future of Paragon is that we have a team of experts who have been there, done that, been in the same boat as everybody else on healthcare, and really care about making sure that the future of our healthcare system is healthier and better for each and every American.
In the future, what I'd like to see is personalization in healthcare so that patients' individual needs are treated. You know, there's not one-size-fits-all solutions, that the patients are in control, and that the health system isn't so geared toward protecting the interests of incumbents and special interests, and more entrepreneurship and innovation in healthcare that's focused on the patient and not about the bureaucracy.